All right, let's jump right into this explainer. Today, we're unpacking some truly eye-opening and frankly pretty concerning sources that dive deep into the catastrophic risks of institutional silence. We're talking about the looming AMR pandemic, that's antimicrobial resistance, and the very real, very profound consequences of just ignoring medical ethics. If you've ever walked into a clinic and felt like, you're just another line item on a spreadsheet rather than an actual human being, well, stick around because this is going to be incredibly revealing.
Just listen to this quote for a second. It really sets a chilling tone for the journey we're on today. It perfectly captures the dark heart of a broken medical bureaucracy. See, we all kind of want to believe that the institutions built to protect us are these infallible pillars of truth, right? But the sources we're digging into today argue something completely different. They suggest that modern healthcare has, in a lot of ways, totally shifted away from patient well-being, and instead it's laser-focused on protecting its own reputation and profit margins.
So let's look at Section 1, the cost of institutional silence.
Moving right along to Section 2, AMR, a looming global threat. Here's where it gets biological. When massive institutions prioritize compliance over their own conscience, nature eventually pushes back. Hard. Look at these numbers from a UK government commissioned study. By the year 2050, antibiotic-resistant illnesses are projected to cause 10 million deaths every single year. Let me just repeat that. 10 million. To put that into perspective, that's like wiping out a major world city annually. And the financial hit? Try a jaw-dropping $100 trillion. We are quite literally staring down a future where our medical cabinet of effective drugs is just completely empty. And the main culprits behind these staggering numbers, they're known as the escape pathogens. Because we've leaned way too heavily on antibiotics, these specific superbugs are basically the absolute biggest threat in hospital settings today. They're taking what used to be totally routine medical procedures, think basic surgeries, chemotherapy, or even just treating a minor scrape, and turning them into life-threatening events. It's wildly ironic, but the very environments that are built to heal us are inadvertently acting like incubators for these superbugs. Which brings us to Section 3, a whistleblower stands alone. To really understand how this global crisis starts locally, we have to look at the story of Dr. Kadiyali Srivatsa. He spent over 30 years in pediatric intensive care and uncovered something horrifying. Unqualified staff within the NHS were essentially playing doctor. They were taking on diagnostic roles without the actual medical expertise. We're talking about treating simple viral dry coughs as bacterial chest infections or hitting basic rashes with high doses of steroids. This kind of stuff directly fuels that dangerous abuse of antibiotics we just talked about. Now, historically, the public often stays silent out of fear. Kind of like how way back when figures like Rockefeller pushed out herbalists and homeopaths, using fear to force trust in allopathy while people just watched. But Dr. Srivatsa, he refused to look away. He spoke up, knowing full well that silence is exactly what allows cruelty and suffering to persist. Let's dive into Section 4, retaliation and moral injury. So Dr. Srivatsa did what any ethical physician is literally sworn to do. He made a protected disclosure. But instead of saying, hey, thanks, let's fix this, the institutions turned their massive power right against him. This actual letter from October 2008 is tangible proof of that ferocious retaliation. According to Hindu philosophy, institutions and leaders reveal their true nature when they treat individuals as insignificant, assuming nobody's watching. They harassed him, humiliated his family, and tried to destroy his career out of sheer arrogance. What they completely fail to realize is a fundamental truth of life. The person you humiliate today might just hold power over you tomorrow. You really have to treat others with respect, not because of who they are, but because of who you are. And the text gives a perfect name to this exact psychological toll, moral injury. It's that devastating feeling when healthcare workers witness unethical acts, like patients being actively harmed by a misdiagnosis, but are forced into silence by the higher-ups. Imagine trying to do the right thing, only to experience profound betrayal from the very organization that is supposed to have your back. It's absolutely crushing, and frankly, it's exactly what drives incredibly good doctors completely out of the profession. This naturally leads into Section 5, shifting ethics in medicine. We're taught to assume that institutional protocols are flawless, right? But the reality is that modern medical bodies are currently fracturing over some seriously profound ethical questions. Take assisted dying, for example. The medical establishment itself is split almost perfectly down the middle, with 45% in favor and 41% opposed. So here's the kicker.
If the highest medical authorities in the world cannot even agree on the absolute most fundamental ethics of life and death, how on earth can we be expected to blindly trust them to always act in our best interest?
And that brings us to our final part, Section 6, Dharma and Patient Empowerment. The sources make a really compelling point here. Karma always comes back around, especially when you look at the current political and economic climate surrounding the NHS and the UK right now, rising unemployment, homelessness, crime, and of course, the rapidly spreading threat of AMR. The systemic failures we are living through are basically a cosmic correction. The antidote, it's rooted in the ancient concept of dharma. Just look at the stark contrast on this slide. On one hand, you have our current adharmic, profit-driven, doctor-centered system that actually weaponizes fear to keep you dependent. On the other hand, you have true patient-centered care, a dharmic approach that is totally transparent, educational, and built entirely on empowering your own health literacy.
This is why Dr. Srivatsa didn't just stop at fighting a 14-year legal battle. He took his 4 decades of emergency room experience and helped build solutions like the Dr. Maya AI and PREMA Kiosks. The whole strategy boils down to 3 simple steps. First, safely understand your symptoms before panic sets in. Second, conquer your medical anxiety, which the text brilliantly refers to as the first infection. And third, completely break that cycle of institutional dependency.
So as we wrap up this explainer, we have to face the reality of karma coming due in our healthcare systems. The person or institution you blindly place your trust in today might totally fail you tomorrow. It leaves us with one incredibly crucial question. Are you going to remain silent, or are you ready to step up, educate yourself, and take control of your own health? The choice is yours. Thanks so much for joining me today.